Welcome to NView Health, Founders Friday show with your host Dr. Lucretia Sewell and Shermaya Holland.
Hi, and welcome back. I'm super excited for our show today, our episode. We have a wonderful guest with us, Dr. Stephen Patton, who is a family medicine physician. I'm really excited for him to share and shed light on men's health in today's episode. And while we're at it and talking about episodes, don't forget to follow our socials. We'll run that down, Shermaya, if you want to.
All right. So we're on Facebook, LinkedIn, Instagram, X,
Blue Sky,
YouTube, all the social media platforms.
So be sure to follow us. And if you're new to us, just another introduction. I am Dr. Lucretia Sewell, the CEO and co-founder of NView Health.
And I am Shermaya Holland, the CTO and co-founder of NView Health.
All right, so let's get right into our conversation today. Dr. Patton, thank you again so much for joining us and having a discussion on men's health. And if you don't mind, just tell the people, who you are and what you do and why you are so important to us in the community.
Well, thank you. I appreciate you guys letting me be on your show today. And thank you for everything that you're doing for the community, especially giving us this opportunity. I think it all kind of ties in together. So a little bit about myself. I am a family medicine physician with Norton Healthcare, and I also work in urgent care medicine, and I'm one of the medical directors for community outreach within the organization, who we are partnered with the Institute of Health Equity. And really the main goal as the medical director is to just get out in the community and have these conversations. We don't know what we don't know. So it's really being able to, inform the community about certain disparities and inequities and resources, and just educate them about chronic disease in general. And then as far as the family medicine aspect of it, it's pretty much I get to see a little bit of everything under each door. I get to establish relationships with patients and continuity of care. Those can come from urgent visits. It can be a chronic disease follow-up. If you have a motor vehicle accident, if there is a pre-op visit, you need to be cleared. So there's a lot of different things that the family medicine doctor can do. And then as far as urgent care, that's more of the acute setting type things. It's not the ER. But it's more of that still of an acute setting. So if you're the sick visits, if you have, need the stitches or sutures or abscesses, things drained in that nature, we kind of watch you over that in that period.
Awesome. Thank you for explaining that, because some people don't know what acute means. So those are great examples for our lay persons who may not know what an acute visit is. But yeah, thank you for shedding light on what you do. And again, thank you for all that you do. So we'll just start by just asking you some general questions regarding men's health. Sorry, I'm a women's health provider and I say women all day. I know men's health. Shermaya, if you want to take the lead on some of these questions.
So what we found is there is a stigma when it comes to men addressing their healthcare needs. So what do you think is one of the big reasons men don't do the preventative care or take control of their health?
That's an excellent question. And, me being a man, I have to ask myself that question sometimes too. Like, if it wasn't required, in the health field, normally we have to get our annuals and get these general screenings in general. So I'm used to the process myself. But what if I didn't have to? Would I be one of those people that's waiting around for something to happen versus, staying ahead of it, which is definitely always better to, get it early than waiting later. So, I think one of the main reasons is sometimes we're afraid to understand what's going on. Can we add something else onto our plate? And I don't think we're ready necessarily to look into that. And even though we understand that finding it and preventing it early is better, I don't know if we have that capacity sometime to do that. And then other times, sometimes we can see that illness is more of a sign of a weakness. I think that's been a cultural thing that we have kind of established where, I've used this example before where if it's a little boy who falls and he's crying down on the floor, we tell him, get up, you're okay, you're strong. And they, okay, I'm not hurt, I'm not injured, I can push through it. We always teach to persevere instead of, acknowledging the pain and saying it's okay, where our counterparts, we may not, just say, get up, you're little lady, get up. And it's over with, right? So we it's in certain conditions, even as we're younger, and then so as you progress to an older age, it's still similar. That's still similar mentality, not only in that man, but with the society too. We start to feel that it's more of a sign of a weakness to address the illness rather than a strength. But that's what it really is. That's not a weakness. It actually takes more strength to confront those fears than wait until there's something, to treat, get ahead of it,
And you mentioned that. Do you feel like it's more of a cultural thing, or do you feel like it is just across the board when it comes to men? Because granted, I'm not in primary care, but I can sometimes notice a difference in how things are addressed or acknowledged or even managed based upon cultural aspects. So do you feel like across the board for men culturally that is something that it has been just like the traditional standard for men to just not to be okay not being okay, if that makes sense?
Yeah.
Yeah, I think overall it's just men in general. I think overall there's just men in general. Now there are certain aspects in health where even as an African American male, I know that I have an increased risk of getting prostate cancer, increased risk of heart disease, and I think some of that plays into. Well, I know some of that plays in from like social determinants of health and social economics, and how that all trickled down to cause different side effects and increased severity of illnesses and diseases, and certain aspects in the Native American and Asian cultures. There are some slight differences, but overall, when you look at it, you ladies are living longer than us. And there's a reason behind that, and a lot of times you all are staying on top of it. And the majority of the times, even when I see us men coming into doctors later on when we have concerns, even when we have the concerns, not beforehand, when we have the concerns, it's she brought me. Like my lady made me come here. So special thanks to you all for staying on top of us and being there for us too. So I gotta give flowers where it's due. No, but no, I think overall it is just it's men in general, and we can see that in different life expectancies. 5 to 6 year difference can sometimes equivalent between a man and a woman. And if you look at different ethnicities, that gap can even widen, especially when we talk about inequities. As far as you can see the difference in lifespans in one side of Louisville versus the other side of Louisville. But that's a different topic per se, but it kind of all plays in a role.
So we're going to talk about some of these high risk diseases and things that occur as a part of men's health. And so some very sensitive topics that we're going to go into, but just doing a little research. So we're going to start with erectile dysfunction and natural ways in which you could, I guess, battle or decrease the symptoms when it comes to erectile dysfunction. But when I did a little prevent, yeah, well, I don't know. Some of it may not be able to be prevented. So we might need to talk that first. Like, is there methods to prevent it? But
we don't want that.
But in some regard, like when doing some research, there's a significant amount of numbers, like 24% of men experience erectile dysfunction from 18 younger. And then the numbers significantly increase as men start to age. So I know it's a sensitive topic, but is there methods to prevention, but I guess the decreasing of symptoms?
No, I mean, and it's beautiful that you guys brought that up, actually, because we do need to have conversations about this, because it is a thing, as you said, and even in that age range, young men need to understand that it is possible for them to have those issues too, and that's okay, and it's a normal part to be able to bring that up and talk to your doctor to look up different reasons. And there's ways that we can do things to lessen that effect of possibly having those dysfunctions later on. But if we do have it, it's not a problem. There can be different deficiencies in hormones, and there can be a damage to your vascular system. So for things like in hypertension, with diabetes, things that's causing damage to blood vessels, because you need a strong blood flow in order to get an erection. So if you have those diseases, it can put you at increased risk of having erectile dysfunction. There are certain surgeries that can put you at increased risk of having an erectile dysfunction. There's medications that can also put you at risk of having erectile dysfunctions. But at the same time, when we talk about those causes, we can look at the preventative measures like frequent exercise, getting good cardiovascular health in, because you're thinking about blood flow once again. So anything that's challenging increased blood flow, eating healthy, because these processed foods and these sweets and these sugars, that they're causing damage to the body too, and low-grade inflammation, which is also cutting down on the amount of blood flow that can get to that body that's needed. Are we looking at our pelvic health? How our men, stretching in that area, keeping the flow, because we have a whole bunch of different muscles and fascia that connect everything. And I tell people to think about it as a water hose. If the water hose can't get the fluid, it's not going to be not going to be a very good water hose. It's not going to get the dysfunction, correct?
Yeah.
Right. So the same thing, we have to be intentional about stretching frequently and good pelvic health. And then other things, men can do Kegels too. That's the thing. Yeah, men can do Kegels. Please relax. Like now, look at you. I think you got me doing Kegels on TV. Oh my goodness. but no, but no, it's really a thing. No, but I mean, it's true, and it's exercises we can do. Eating healthy and eating certain types of food, and they also have to think about the risk of tobacco abuse and alcohol or obesity, and we already named some things like hypertension and diabetes can all increase that risk of having this erectile dysfunction. And mental health, if we're not mentally there, are we have to have those conversations? Am I attracted to my mate? Do I have that connection, with that person? Those are conversations you have to have. How do I feel about myself? Because that all plays a role in being able to have that erection as well. So when we discuss the different problems, we can start looking at the solutions. Mental health, therapists, obesity, regular exercise. Did you know that fat has a aromatase? It has an aromatase inhibitor, I believe, and it kind of can turn testosterone into estrogen, right? But also you have to know that if you drink liquor, it can take about 3 days to even burn fat. So every time you're trying to burn fat to boost your testosterone and exercise more, so your erection and things can be better, you have to think about: am I drinking too much? Do I need to cut down on the liquor? And what am I doing in that nature? Am I eating healthy enough where the fat doesn't accumulate? Am I working out more frequently? So these are the same things the problems. You can kind of list the problems and then look at the solutions, and the best thing is to have a discussion with your doctor. So that's another important reason to get in there.
Great conversation, great topic. So I think another, while we're in the area, one other thing that young men don't think about, testicular and prostate cancer, those types of cancers. I know testicular is more of a young man's cancer, but even going forward for prostate. So the risk of getting screened, I know men are like fearful of being screened of those things. Can you kind of tell them the process of that, or even just discuss it in general, so that I guess it's less of a fear for men when it comes to taking the step and owning the fact that it is something that you certainly need for prevention?
Yeah, so there are, if you look at it, you're going to see some different recommendations on prostate screening. The news I use majority of the time is we can do prostate screening with the PSA, prostate specific antigen, and that's through blood work. Whereas before, people were doing more of a digital rectal exam and screening for the prostate, which you can learn different things in that nature. Now, through the blood work, through prostate specific antigen, when you're screening that, there are things that can cause an elevated PSA level. Infection, or if the prostate gland is swollen. Cancer is definitely on the differential of having an elevated PSA as well. So, sometimes we will have to monitor that. And then if it continues to be elevated, do we treat? Are you having other symptoms? Is it burning when you're urination? Are you having pain in your back or in your rectum? Are you having urgency where you feel like you got to go? Is your urine stream weaker? These are symptoms that you have to calculate along with when you're getting this PSA. But when you're doing just screening in general and not having symptoms, people can also, they worry about getting a fake false positive, and then you have to go on to get a biopsy, which it doesn't necessarily mean it's always going to get the cancer. Normally, they normally do a couple incisions, but that doesn't mean they're always going to get the spot where the cancer is. So there's risk of false negatives with the cancer, or they may not have gotten enough from the random samples because they can't see in there when they're doing that, right? But that can also cause a risk of the things we were talking about before, as far as the erectile dysfunction and things in that nature, right? Or infection or other causes. But the good news about that is they're coming out, technology is getting better. So now they have like a MRI. So they can actually, and I would recommend that if you are getting your PSA levels checked and it's elevated, and prior to the biopsy, they're either doing an MRI now, they can see the lesions a lot clearer, and they can identify if that lesion is more likely to be cancerous or not benign. Can you just watch it without having to do the biopsy, right? Or sometimes they're doing it together, where you can do an MRI and biopsy, so it gives you more direct precision, so up to almost 90% more accurate than just doing a random biopsy, which is a big game changer, because prostate cancer is still one of the leading causes of cancer in men, regardless of the risk, right? And then if you're African American, they suggest you get screened at age 45, start screening then. And when we're thinking about that, the 5-year survival rate of cancer, if you catch it early in prostate cancer, is almost 100%, versus the 5-year rate later is almost less than 35%, around somewhere around there. But it's a significant change if that cancer has spread. So it's always better to go ahead and get that disease earlier, especially when we're having more technology now that allows us to be more accurate and decrease those risks that we were initially afraid of.
Thank you for providing that insight. Yeah, so good that they know that there are lots of things that can be leveraged for screening. So yeah, that was wonderful. So I guess we talked about several topics, but let's get right into the leading cause of death for men. Like, what is the leading cause? Like, share with the people.
Yeah, no, cardiovascular disease, right here, heart disease. And I think a lot of that is, first off, we need doctors. And when I say we need doctors, I mean men need to get established with a primary care doctor, so we can do annual screenings like checking your blood pressure, checking your cholesterol, things of that nature. And we have to understand that even sudden cardiac death, there's like over 330 or 28,000 odd cases a year. That means sudden, no warning. But you can get screened, because if you catch it with high blood pressure ahead of time, or something going on with your kidneys ahead of time, before this occurs. So a lot of times we aren't getting these screens and checked. And then, like I said, these are the same risk factors, the obesity, the smoking, the drinking, things in that nature can also put you at increased risk of having this heart disease. So yes, that's the number one killer in men in general, and that's worldwide.
Yeah. What's some of the preventative things that men can do? Is it exercising and the preventative maintenance,
Lifestyle, like
lifestyle modifications?
Mhm.
Yeah.
Oh yeah, most definitely.
Got your dirty
30. Oh, give me the plug. Yes, please. Thank you. No, thank you. Yes. So definitely 30 minutes. Now, the American Heart Association suggests 30 minutes, 5 times out the week, majority of the time, right? That's the one I like to go with. If you can't do that, you can try to do like 90 minutes of vigorous activity within the week. Now, the Dirty 30 challenge is challenging people. You can do 2 challenges on there. Work out 30 minutes for 30 days in a row. Walking counts, as long as it's keeping it active, keeping the heart rate up there, and keeping it moving. Or you can do 4 days out the week for 30 minutes, and it's just a workout support group, and that's on Facebook. If anybody wants to come and join that Dirty 30 workout challenge. But yes, that's one of the main big things. Definitely stop smoking. Smoking is bad for you on all occasions. Increased risk of cancer, increases the risk of messing with the erection, increases the risk of heart disease. It's just bad overall. So if you can stop and put that down, I recommend it. Eating healthier, and if you get confused with all the different types of diets out there, try to figure out the closest thing that's best for you. But I always say fast food or home cooked, you're going to do home cooked. Fried or baked, you're going to go baked. And I would say if you're going to do anything, go more towards lean meat and your vegetables. Try to stay away from all the processed foods, the sweets, and the sugary drinks. That's just a quick guide on as far as diet. Now, the Mediterranean diet, if people want to look that up, that's one of the most beneficial diets. But like I said, the best diet is the closest thing you can stick to consistently. Maybe you want to talk to a nutritionist or something to get put in the right direction and see which one works best for you.
Yeah. Thank you. So it brings us to our last question, and it kind of shifts a bit from a physical health to mental health. Because mental health, again, as you stated, is just as important, and it can also, inform your physical health as well. So, do you feel men are comfortable discussing mental health?
I think we are starting to get better with discussing mental health. I think as we get these primary care doctors and continue having these discussions, like with you all and other organizations, I think we're making that discussion of mental health more of a normal thing, along with getting established. I think it is hard because that's more of a vulnerable position, and it's really about having that space. I know majority of the times, I think a lot of that stuff happens in barbershops too, and in your churches, there's different places. But there's a reason that men are leading in suicide, versus women. And a lot of that is because we have more access to the weapons. We normally like to go for more access to guns and things of that nature, which is one of the main causes of suicide in men. And the reason we are having a higher rate in suicide is because we aren't getting this addressed in the amount of time before it becomes too late. So the biggest thing there is, even in suicide, and you're talking about mental health within men, you want to look for signs like a sudden change in mood. Have they been depressed and all of a sudden they're just real calm or happy all of a sudden? Are they giving away their personal items? And don't be afraid to ask, are you having suicidal thoughts? I know it's a hard question, but the best thing to do is be direct with that. Like, are you having suicidal thoughts? I'm here for you and looking for different resources. But it's really important to start having that conversation. And even when we're using a therapist, how do we use the therapist? A lot of times people say, I go there, I don't know what to do anyway. But the first part is just getting those thoughts organized, figuring out why you feel that way and what you can do about it. So I think it's really important. Mental health occurs, and in my mind, I would like to think that we are starting to have a lot more conversations about mental health, especially the younger generation who have access to their phones. They know a lot more than we think. And I think mental health, being able for them to see that stuff and understand some terms. I've heard gaslighting a lot more lately than I did back in the day, right? So we're becoming more familiar with it.
Well, thank you, Dr. Patton. It's always a pleasure to have you here with us discussing anything as regards to health and the things that you do in the community. But tell everyone where they can find you and how they can follow your work.
I appreciate you, ladies. I can be found at Madman for You. That's MEDMAN for you, and that can be on. I'm normally on TikTok, Instagram, Thread, and then of course said the Dirty 30 Workout Challenge. You'll find me on there because I'm working out with you too.
Yeah. Awesome, awesome. And then just want to mention that his details are mentioned in the description below. So yes, thank you for spelling that out for the folks as well, so that way they can connect and find you, and hopefully make you their primary care provider. Because as you mentioned, having a PCP is imperative for preventative care and just extending life and all the things. So yes, thank you again, Dr. Patton. Are there any last words that you like to leave the people with? Not to put you on the spot or anything that you just want to share before we conclude this episode?
Yes, prevention is key. I'd rather pay for the pound of the pumpkin seed than pay for the pound of the pumpkin. So get it while it's small and light, where you can get taken care of, rather than putting it off, because you're going to pay for it one end or the other. So you might as well get it early.
That's very true.
All right.
Very true. Well, thank you again. And I guess we can close out again just by reminding you all how to follow us on all the social media platforms. As Ms. Shermaya mentioned before, we are on
LinkedIn, Facebook, Blue Sky, X, YouTube, all the social media platforms.
Yes, follow us at InView Health. And don't forget, Indie Soup Media. This is where we are having all these videos hosted. And please, please, please make sure you give them a follow as well. Thanks so much for joining us. And until next time, we look forward to having you back. Thank you.